Hi, welcome to the Med Squad podcast. Now, there are times we have topics that are taken lightly, and after listening for a while, they're taken more seriously. But there are also those topics that start out really serious. And then, depending on where you come from, they are taken lighter and lighter. So right now, we're going to focus on the medical legal aspect of abortion in Africa. My name is Yafesi Musoke, and I have the Med Squad with me. Please introduce yourselves. I think we'll start from this side.
I'm Dr. Flavia Bagatia. I'm a medical officer and I'm very passionate about women's health.
My name is Dr. Kelechi Okoro, also known as the Health Attender. I'm a public health advocate and a strong, loud voice for sexual and reproductive health.
I'm Georgina Nyaka, a general practitioner, also passionate about women's health.
All right. So now we get into this topic, which, of course, it's quite obvious. I'm a man, so I'm seeing this from an outsider's perspective. The question that would obviously first come is, in most African countries, is abortion even legal?
So legalization of abortion in Africa varies in different countries. And it's majorly based on the Maputo Protocol, which is a legal framework that protects women and girls' rights across Africa. It was adopted by the African Union in 2003. And Article 14 of the Maputo Protocol recognizes sexual and reproductive health rights of women, including safe abortion and access to contraception. So most African countries adopted it. However, they did not implement it. It remained on paper.
Okay.
So in 2014, the African Commission came up with a user guideline to explain and to help African countries operate on the Article 14, which legalizes safe abortion, especially in cases of incest and rape. Some countries have been able to legalize abortion broadly in conditions such as rape, incest, like we said, but also socioeconomic factors. Basically, a woman can go into a facility, a health facility, and request for an abortion, and it is given to her. And these countries have also included safe abortion into their healthcare systems. We're looking at countries like Mozambique, South Africa, Benin, and Ethiopia. Then when you come to the other hand, the other side of the story, abortion remains restricted in other countries like Uganda, Kenya, Nigeria, and Tanzania, whereby it's only legalized if the woman's life is in danger.
There are countries where it is banned completely.
I first need to clap for those countries that implemented those,
The Maputo Protocol.
Exactly. Round of applause for them. However, my country, Nigeria, it is restricted. Okay? It is very restricted only when it is a danger to the woman's life. However, in cases of rape, in cases of incest, in cases where there is fetal complications, there's no abortion. You're not free to get an abortion. Okay, and it also differs in Kenya. You call it counties, right? Over there, the southern region and the northern region. For the southern region, there's a penal code. There's a criminal code where even when you go to access or procure abortion medications, it is a crime. You're not pregnant, but you're going to procure it, it is a crime. And then for the northern zone and some other zones, if you attempt abortion, for the medical officer or for the whoever it is, the professional who is giving you that abortion, you have 14 years imprisonment. Okay? And for the woman who wants an abortion, she gets 7 years. Exactly. So now we're saying that generally you say when it is a risk to the woman's life. But when they talk about that, they talk about her physical health, her biological health. How about her financial health? How about her emotional health? Okay. How about when the fetus or the child she's carrying has severe abnormalities? We're in a place where, we're in the African society where people say a child is a gift from God.
Yeah.
No matter how it comes, no matter if it has chromosomal abnormalities, it is a gift from God. But when that child has a very, very low risk of survival, why let that child come, right? So that's why we need to start talking about, and a lot of organizations are beginning to talk about reform. They're calling for reform for these restrictive laws. When it's a case of rape, when it's a case of incest, and also when it's a case of fetal abnormality or the child cannot live, then the women should be able to get access to abortion. That's what people are saying, because people want to be politically correct, because it is a very sensitive issue.
Yeah.
But there are also other people who are advocating for through and through. It's woman's rights, her body, her choice. Okay? If she wants an abortion, she should be able to get safe abortion, not just abortion from anywhere, safe abortion.
So what happens in the countries where it's totally banned? Because you've created a picture in a restrictive environment, but what happens in the countries where it's totally banned?
So one of the countries where abortion is like totally banned is in Madagascar. So one thing we should all understand is that in reality, abortion is banned, but it is far from what is happening on the ground, because statistics show that, like, globally, 3 in 10 pregnancies, this is data that has come up as of April this year, 3 pregnancies out of 10 pregnancies, 3 end up in abortion. And you see, where we have restrictive laws where they've totally banned abortion, people go for unsafe abortions, which later on complicate the woman's health. Yeah.
So when you're talking, I mean, this is April 2025.
Yes,
Talking
April
about 30%.
Yes.
30% of pregnancies. So the obvious question would be, is abortion un-African? But at the same time, are we looking at, is it an issue of terminology?
Okay, so if you ask me, abortion is African. It is not un-African. It is just unfamiliar with the recent terminologies, the recent, cultural evolution, right? Because from the days of old, from before Christ, before our ancestors, they have been taking steps towards their reproductive health.
Yeah.
Women are not just getting pregnant now. Sex has always been in existence, and people have been getting pregnant. People have been getting unintended pregnancies. So how have they been doing it? They've been using traditional methods. Okay, for example, in Nigeria, our foremothers, is there anything like foremother? Our ancestors, our foremothers.
Foremothers and forefathers.
Exactly. They have been using things like, there's something called obono, wild mango fruit, wild mango seed. So when you take it in excess, when you ground it and take it in excess, it has been said to, to cause abortions or to cause uterine contractions. And then once a woman is pregnant and she starts bleeding, okay, the process has been started, okay? Things like something as simple as pineapple, when taken in excess, hibiscus, it's called zobo, when taken in excess, lime, ginger, when ground together and taken in excess. Sometimes people take dry gin, and they add some very strong painkillers, and they take it in excess, okay? And then for some people, they call it soft belly. If you have a soft belly, you start bleeding, because alcohol is not safe in pregnancy. There are some ingredients that are not safe in pregnancy. As simple as something as small as, it's called uziza seed, uda seed. These are things that are used to make pepper soup. So there are some foods that women are not supposed to eat when they are pregnant. So when you're not supposed to eat something when you're pregnant, what are you trying to avoid? You're trying to avoid a miscarriage. So when they have that knowledge, then of course, humans are adaptive. They say, okay, since this can cause, a miscarriage, then when I take it more, it can cause an abortion. So they've been doing this for a long time. And then in those days, all of a sudden, someone just starts bleeding. We don't know what happened. They don't know what happened. But something has happened. A process has been stopped. And then eventually, maybe they are saved with other traditional products, or they lose their lives. There are undocumented cases where women have lost their lives. Pregnant women start bleeding and they lose their lives, or their pregnancies are contained. No data, no scientific backing, but these things have been happening. Women are from the olden days, they have been preventing pregnancies, okay? Sex did not start today.
Yes.
They say this generation is promiscuous. No. Sex did not start today. Sex has been in existence. Pregnancies have been happening, and unintended pregnancies have been stopped.
Yes.
So it is not it is a very African thing, but it's just that in the current context of, abortion, when people talk about abortion, they're thinking about the medical procedure, manual evacuation, they're thinking about drugs, ifepristone, misoprostol.
Yeah.
Those things were not there in those days, right?
Yeah.
But for now, those are the things you think about when you talk about abortion. So it is unfamiliar. And then there's a lot of shame and stigma, and we're acting like we don't know that these things have been happening. So it is not un-African, very African, but just unfamiliar with the current situation.
And the technology has changed.
Exactly.
Politics and religion has affected the acceptance of abortion in Africa. For politics, we look at political leaders because abortion is unpopular with their supporters. So they'll try to be rightful and not support it. Some even say that it is something driven by NGOs and donors. Then we look at religion. Some religions say life begins at conception. So abortion is murder.
So now, there's a term that was brought out. You mentioned miscarriage. Is there a difference between, or at least medically speaking, between miscarriage and abortion?
Abortion and miscarriage is the same thing. But in the medical, so when it's an outsider or layman talking about it, they call it abortion, right? But as a general term, so there is missed abortion, there is threatened abortion. Please, my colleagues can help me.
Yes.
There is incomplete abortion.
Yeah.
So, and all of these are terminologies that the layman will call miscarriage, right? That's total abortion, complete abortion. That's what miscarriage is a complete abortion.
Is it in...
To make it simple,
Okay.
there is induced and spontaneous abortion. Induced is when someone has started the process themselves. Then spontaneous is what you would refer to, it happened naturally, maybe because of congenital anomalies. It just happened. She didn't intend it. So we have the induced and spontaneous. And then when you look at the induced one, in some countries like Uganda, they term it as criminal abortion. So when you go to hospital, they'll ask, is it criminal or is it spontaneous?
Oh, so now, so the miscarriage or the spontaneous one that's spontaneous, but induced is criminal.
Yes, induced is criminal.
Okay.
So it's the spontaneous one that the layman calls miscarriage. But the medical doctors will call it a spontaneous abortion.
Okay. So with regard to pro-life versus pro-choice, is that something that has to be medically determined? Because you can come all of these backgrounds, the faith and cultural and the backgrounds that inform your view on abortion. Is it something that can be, whether you're pro-life or pro-choice, whatever the case may be, is that something that's determined by the information and knowledge that's given medically? Is that a medical decision, whether you're pro-life or pro-choice?
So it comes down to when a woman walks into a facility and asks to have an abortion. So in countries where abortion is totally restricted, like in Madagascar, they might not offer it, but in other countries where it is restricted, to mean in cases of incest, cases of rape, or where carrying the pregnancy to full term would put the woman's life at risk. So there are medical personnel who would offer it in accordance to the Maputo protocol because it is the right of the woman. And there are other places where they will just reject it. Yes.
Okay. So then I'm trying to figure out how to define, because that's why I was asking, is it an issue of terminology? The word abortion has such a heavy connotation, such an implication of, in some places they're thinking it's a evil intent. In other places they're thinking it's a word that we use for either political or social kind of advocacy. So if we were to define objectively, medically, abortion, what is that?
So medically, abortion is the expulsion of the products of conception before the fetus is viable. By viability, we mean before the fetus can survive outside the uterus independently. So different countries have different ages of viability. For example, in Uganda, they've come down to 26 weeks. In Kenya, it is 28 weeks of gestation. So to make it simple, it is terminating a pregnancy before a baby can survive independently outside the uterus.
Now, in cases of incest or rape, there has to be a burden of proof. So what's the reality? Is because you're working also with police or law enforcement, how difficult is it for people to prove that side or to get the care they are seeking under that premise?
Okay, so before I answer that question, I'd like to also talk about another terminology that you'll be hearing here, and that's unsafe abortion, right? So unsafe abortion is any abortion that takes place that is done by a non-qualified or unprofessional or a quack, and then it's done in an unsanitary condition.
Yeah.
That is called, and which also has complications like death, hemorrhage, infections, sepsis. Yes. So that's an unsafe abortion. So really, the problem is not abortion. The problem is unsafe abortion. Exactly.
Okay.
So now back to your question, rape, incest. How many times in our African society have you heard, a child come out and say, I was raped by my brother, raped by my sister, I was raped by my uncle, my auntie, I was raped by, my father, my mother. How many times have you heard that? So we live in a society where things like this are hush-hush because you don't want to put a dent on your family lineage.
Yeah.
Even sometimes your mother will tell you, oh, shh, don't say this. This is your father. You want to bring shame to a family name. Who has brought shame to the family name? It's the person who perpetrated the criminal act.
Yeah.
Exactly. So most of the time, we don't even hear these things happen. Okay. The case of rape also, there's stigma around rape. The person who comes out to say, I was raped, becomes the victim. Becomes the victim of shame.
Yeah.
If you come out as a female to say I was raped, the first person to ask you, what were you wearing?
What did you do?
So the men who rape children, the pedophiles, what was the child wearing? A child is wearing diaper, soiled with feces, but yet you penetrated that child. What was the child wearing? So when you even say that we're trying to speak up and say we're trying to call for reform around for pregnancies that were an outcome of rape and incest, how many people will come forward to say this is the case and this is why I want an abortion? Okay, so really, yes, these things happen, but I believe that when there's a law that says, okay, it is rightful by law to seek abortion if you have been raped or it's a case of incest, then maybe people will come out and say, this is what it is. Or another thing that can happen, even women that were not raped, even children or women who were not a victim of incest would say, okay, since there's a caveat here, let me come and say this is the condition by which I got pregnant and access abortion.
But again, to add on what she's saying, you see, in cases of rape, for you to prove that you had been raped so that these services can be offered to you, let's take, for instance, a lady was raped and she goes to report to a police station. It technically comes down to how much time have you taken before you've gone to the police station. Have you showered? Because it erases the evidence. Have you changed your clothes? Have you discarded your clothes? So it comes down to, did this lady know taking a shower, getting rid of the evidence by maybe throwing away those clothes or just taking time to go to the police station? You've already discarded the evidence. So even if you go to the police station and then they cannot perform a rape kit exam on you because they will find nothing. So proving that you have been raped so that you can get these services is hard sometimes.
Wow. On the Med Squad podcast, as we continue this candid conversation, well, when we come back, we'll be looking at that tug of war, the reality on the ground in Africa versus whether it's a moral argument or is it a medical argument. We'll be right back. Hey there! Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the Med Squad.
Here, care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks and we translate.
Your mental health is not a luxury. It's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the Med Squad. Real conversations, real health, real people. From your inbox to your bedside, we're with you. Welcome back to the Med Squad podcast. Now we're talking about something that's highly sensitive in lots of areas, but is something that definitely needs to be addressed. We're talking about abortion and the realities in Africa. Now, there's a statistic that says as at about 6 years ago, 2019, around there, 92% of women who are of reproductive age live in the 43 countries with highly restrictive laws. So, you had mentioned how some countries are implementing the Maputo Protocol, but what are doctors permitted to do and what are they not permitted to do? Like you live in a restricted country, separating emotion, putting in professional ethics and all that. What are doctors permitted to do and not permitted to do?
In countries like Uganda, Nigeria, and Kenya, abortion is not legal and it's only permitted in cases where the woman's life is in danger. But again, even the law doesn't clearly state which conditions is the doctor allowed or permitted to do that. It is more of a case-by-case basis. And it's according to how the doctor assesses the situation. So, on the other hand, because of our ethics, we provide post-abortion care. That one is universally available. In post-abortion care, we look at providing antibiotics, prophylaxis antibiotics for these ladies, providing painkillers, counseling, giving them contraceptives, and also counseling the community against stigma, stigmatizing these ladies. We also link them up to other specialists like therapy.
Okay.
But again, post-abortion care it doesn't matter whether the abortion was induced or spontaneous. We provide it for everyone. So in that case, it's legal to provide those services. And we are supposed to. Yes.
So,
Please, so that I don't lose that thought.
Yes.
So now, it's this, what you just said, that is the extant rule, right? But from a personal angle, I see so much hypocrisy in it. Before you put a law that avails post-abortal care, even in the case of, induced and not induced, that means that women are going to they're going to find a way to have an abortion, whether it is legal or not. Then you're trying to be on the safe side and you're saying, okay, go and do whatever you want to do. It is not in my hands. But when you come for post-abortal care, I would offer it to you. Okay? And that's why the point you raised about education, okay, making contraceptives available, sexual education, access to sexual and reproductive care products.
Yeah.
It's very important because there's something that happens in where I come from. You go to a hospital and they tell you, sorry, we don't offer abortion services. Then, I'm sorry to say, you know that they don't offer abortion services, but you now tell them that, however, we offer post-abortion care. So if it's incomplete, if you're bleeding, if for any reason anything goes wrong, we will offer you care. What does that person do? A woman wants to survive. See, there's something I keep saying anytime I talk about abortion. Any woman who really wants to have an abortion will stop at nothing to get it, including death. Some people, they do not want that pregnancy. They know that there's a possibility that they're going to endanger their lives, but they go ahead to do it anyways, even without the knowledge of the post-abortal care. But I do not want this. I cannot imagine someone who is a young girl who's 16 years old. She just got admitted into medical school. She's supposed to be the first medical doctor in her community.
Yeah.
And then somehow she has an unintended pregnancy. What do you think she's going to do? Or a girl who was raped by a clique of armed robbers in her community. That means your child is not going to have one father. And you're going to be reminded every day, not just you, your child, when he or she is born, that you are a product of gang rape. When you think of all of these things, the fact that you might lose your medical degree and then you're going to be a shame to your family and to yourself. What do you think, if you're that young girl, what do you think she's going to do?
So I have a question that follows from what
you need to answer me as a young girl.
I do not know.
You do not know. You're trying to be, to stand on the fence.
Not stand on the fence and let you, from experience and expertise to inform me, because I'm here to learn.
All right. So that girl would most probably seek an abortion. And if she goes to the hospital and she doesn't get it, she will go to the quacks, knowing that sometimes they don't know. So, they might die or have complications like bowel perforation, like genital trauma, infections, and like all those things we mentioned. But those who know will go and do whatever they need to do and then come back for post-abortal care.
So this is the question then. In fact, Dr. Georgina, this, so Dr. Kelechi has talked about the hypocrisy. Now, how does this tug of war, knowing that you can provide post-abortive care and not provide abortion services in certain cases, how does it conflict or have that kind of head-on collision with the Hippocratic Oath to do no harm? So there is hypocrisy that affects Hippocratic Oath.
Okay, so let me start first by adding to what Dr. Flavia was saying, instances where abortion can be provided. So, like in Kenya, abortion can be provided when the life of the woman is in danger. For example, there's something we call eclampsia and preeclampsia. It's like having hypertension, high blood pressure in pregnancy. So the ultimate treatment of preeclampsia is delivery. But now here comes a case where the woman has this condition, but is at like less than the age of viability. Meaning carrying this pregnancy to term will ultimately lead to the life of the woman being in danger. So it can be provided as at then. Or in instances where the pregnancy has grown out of the uterus, like in the fallopian tubes or anywhere else besides the uterus. So in such instances, an abortion can be provided because, as you've said, it's either termination of an embryo or a fetus. To come back to your question, in the tug of war between hypocrisy and upholding what you swore as a doctor. So one thing we as doctors know, the patient comes first, their health comes first, and the patient is always right. So whether somebody comes and asks for an abortion or whether my country permits it or not, and like she said, when a woman decides to terminate a pregnancy, whether they'll outrightly ask for it or do it, putting their lives in danger, they will ultimately do it. But when we as doctors swore not to harm the patient's life, it comes down to the legal matters for the country. In Kenya, you cannot provide it. Most people would come and they're like, I want this. But I, as a doctor, know I cannot give it to you because the country does not permit it. So yes, you as the patient is right, but I'm restricted by the law.
Okay, so I'd like
Also-
to add something, and I'll take us back to pro-life and pro-choice. I always say everybody is pro-life until the choice comes close to home. I'm pro-life, I can't have an abortion, I can't advise somebody to have an abortion. But when it's your turn, it is your personal decision. And when push comes to shove, most people will revert quietly to pro-choice. They want to take a choice to have an abortion. And then also, how many times have you heard that a religious leader, that someone gave birth for a religious leader? We have cases like that a lot. When it comes to a religious leader or the child of a religious leader who has an unintended pregnancy, they quietly go and seek abortion because it has come close to home and it would, dent their image. So like I said, everybody seems to be pro-life until they're pro-choice. Another thing I would say when it comes to doctors, right? The Hippocratic law says, do no harm. So I believe that as doctors, if you cannot provide that service because of legal binding, right? And I would only only accept that a doctor is, taking that stand because of the legal implication in their country, not because of their personal opinion. Because as a doctor, you are a doctor. You're not a pastor. You're not a moralist. It's just like when sometimes because you are because you don't accept somebody's sexuality, you refuse the person care just because you don't like their sexual orientation. As a doctor, it's not your business. That person is human and the person deserves care. Okay, so like I was saying, as a doctor, one way to do no harm is to refer or give the person education about where they can get such services. You're not going to provide the service. Because in countries where, like in my country, there are some states that can actually, you can get access, So as a doctor, equip yourself with such information so that you do not send your patients to the jungle. Because once they are living there, they are going to the quacks, they are going to find some solution. So you don't just say, we do not offer this service here. Sit your patient down, like Dr. Flavia said, educate, counsel. And the truth is, you might counsel the patient. You know how counseling is. You don't tell the patient what to do. You tell the patient the pros and the cons, and the patient chooses. In a lot of cases, the patient chooses to keep the pregnancy because now they know the pros and the cons, not just the medical pros and cons, economic, emotional, and they can make informed decisions. So as a doctor and you're operating under Hippocratic oath, when a patient or a woman comes to you for abortion care, also for abortion, she's not just coming to you for a service. She's coming to you for help. She's coming to you for solace. She's coming to you for your knowledge. So it doesn't matter if you cannot offer such service. However, educate her and refer her to where she could possibly get such services. Yes.
Flavia, you want to jump in also?
Yes. We're looking at saving life. If a woman came into hospital and she has complications of abortion, let's say she's bleeding or she has sepsis, even when she tells the doctor that she induced the abortion, maybe medically, she's not going to be chased away. The doctor will definitely attend to her. So it's about saving life. Yes.
Okay. Now, there are some certain things we're going to talk about from a different perspective here. This is now on the other side of abortion. When we come back right here on the Med Squad podcast, stick around. Welcome back to the Med Squad podcast. And this conversation, it can get heated, but it never loses the seriousness with which it needs to be treated. And one of the things now we're going to talk about is real complications. So there's someone has sought abortion, sought an abortion, and then afterwards, sometimes we are stuck on the aspect of the abortion, but the whole story or the whole context surrounding it sometimes is missed out on us. So when we're talking about real conversations, what are some of the real complications that are possible?
Okay, so we have the medical complications, that's severe bleeding, that's severe hemorrhage, we have the infections, we have sepsis, and then we have, if it was done like a surgical procedure, or insertion of sharp objects. Okay, in universities then, or even in boarding houses, we used to hear that there are seniors in the university who know how to do abortions, right? Something that we had to go to medical school, become interns. I'm sure as a medical student, nobody attempted a manual evacuation. We attempted under supervision as interns. But in boarding houses, in universities, we have experts, senior girls who can use hanger
Clothes hangers
to do a manual evacuation. So with that, you can have perforation, and into the surrounding organs. You can this can also lead to something called Asherman syndrome, where you have to scrape the endometrium, that's the womb, the inside of the womb, so much that you cause something called Asherman syndrome, which can lead to infertility. Okay, so beyond the medical complications, something that we do not talk about enough is the emotional, the psychological complications. Nobody is the same after an abortion. And that's why I laugh when they say, oh, if abortion is legal, if it's freely accessible, then people will use it anyhow. Who wants to have an abortion over and over again? Women do not want abortion because they are reckless. A lot of women don't get pregnant because they are reckless. Sometimes it's just an unfortunate situation. And even when, they use contraceptives, there's no contraception that is 100%. Even the barrier method, which is the condom, is 99%, right? Or 98%. Even the pills, the hormonal contraceptives, no one is 100%. Sometimes you can use the emergency contraceptive pills and you use it beyond 72 hours because you did not know, or you get an expired medication or a fake medication and it doesn't work. Doesn't mean you were reckless.
Yes.
You knew you had sexual intercourse. You knew you had to take emergency contraceptives. You did, yet you still got pregnant. So back to the emotional and psychological complications. No woman is the same after losing a pregnancy or after having an abortion.
Yeah.
So, they think about the pain. They think about the shame that they feel. They think about the shame that the society would make them feel if the society knew. In fact, your partner can make you feel shame. This is somebody who says they love you and you get pregnant and you both decide to terminate the pregnancy. That same partner will not want to marry you because you have had an abortion that was as a result of an act that both of you engaged in and decided to terminate. So these are the issues. So it's not just medical, it is very also beyond medical.
There are also long-term effects of abortion. She has talked about the short-term effects like bleeding and sepsis, but also if it's surgical abortion under unskilled hands, the uterus can be perforated, can be punctured, and the surrounding organs can also be affected. Like someone can puncture through the uterus and into the bladder, and the woman might end up with a fistula. And also because of that, again, the uterus might end with fibrosis, with scar tissue forming, and the woman might end up with infertility because there's nowhere the fetus can implant. Yes.
So then, is increased access to contraception the way forward, and family planning education? Well, of course, in the cases of rape and incest, that one maybe it's not as. But with regard to pregnancy, is it at least a positive step forward?
It is not at least, it is a very positive step forward, towards reducing the incidence of abortion, but not just access to contraception, right? Sexual health education as early as possible. Some people, when they talk about abortion, they talk about pregnancy, they're looking at those in the universities, those in the secondary school. Someone in the primary school can get pregnant. because we're now having precocious pregnancies where, children at the age of 8, 9, still in the primary school, got pregnant because they haven't gotten their first period and they do not know, or they've gotten their first period and they do not know anything about, their bodies. They do not know anything about all the things their parents have told them is, if a man touches you, that's not sexual health education.
Yeah.
If a man touches you, you get pregnant. That is a very irresponsible way of talking to your child about sex, about pregnancy, about, all of these sexual and reproductive health issues. You should use age-appropriate languages to talk to your children early, and not just the females.
Yes.
Because the females are not impregnating themselves. If the boys are educated, if they are disciplined, it's something that two people have to do, to get pregnant, right?
Yeah.
So if the boys are also educated,
Yes.
it means that you're not just churning out educated and empowered girls, to go into the society and meet boys who are not groomed or who do not know, have the basics about health education. So like I said, sexual health education, and then youth-friendly clinics, youth-friendly sexual and reproductive health clinics.
Oh.
It takes away the stigma.
Yes.
It's not when you are ready to get pregnant that you now have access to that. No. You should have access to this information, to these tools, to this, so that you only get pregnant when you intend to get pregnant. Okay?
Yeah.
And then women-friendly policies. Those people, you see, we're still trying to achieve 35% affirmative action in politics, in African politics. I'll talk about Nigeria because I'm sure of Nigeria. These laws were made on tables where it was mostly men sitting on them, making these rules. They do not know what we go through. So most of these rules are not, when it comes to, sexual and reproductive health, I think that most of these rules are not to empower women. They are to suppress them. They are to control women. They are to control what they do with their bodies. And then there's this conspiracy theory or this agenda where it seems like, we're trying to control population. Like, we're trying to reduce, the incidence of birth. We're trying to reduce the population. I think population control is not about reducing the incidence of births. It's about making women and men, couples, get pregnant when they are ready to, when they are economically ready to, when they are emotionally ready to, when they are, financially ready to. Okay, that's how we should start looking at, contraception, not like we're looking at it like as an agenda, to deliberately stop people from having children. There are a lot of children who do not have mothers and fathers.
Yes.
Okay, so like my people always say, prevention is better than cure. So contraception, and health education, sexual health education, is just enough prevention so that we can reduce the incidence of abortion. Yeah.
Okay. Dr. Georgina.
To add on what Dr. Kelechi has said, prevention is better than cure, right? So there's some news that was recently aired in Kenya that the majority of women who are seeking abortion services are women who are actually married. And then you sit back and wonder, married women, why? So you'll find out that some husbands, or rather men, they do not allow their women to have contraceptives on them. They think that it demeans you as a woman. So what this woman does after she's gotten pregnant, they just go and seek for abortion services. Yes. And again, to think about it, after she's sought these abortion services, she would have been safer if she was on contraceptives. Yeah, so prevention is better than cure.
Yeah.
Yeah.
So this...
It's also important to tackle the myths surrounding contraception.
Yeah.
Because even when they make them accessible, there's poor intake. Because people have myths surrounding the use of contraceptives.
So that has to be addressed in the education or the information
yes,
outreach and campaign. So as we summarize, trying to consider whether this is a public health crisis or a moral debate, what final words would you have to say regarding the reality on the ground versus the context in which we live?
I would say abortion, unsafe abortion, is a public health issue because of lack of access to safe abortion, to contraceptives, to affordable and reliable contraception. Women are seeking unsafe ways of terminating their pregnancies. So it is important to make contraceptives accessible and affordable and reliable. And also we should do the sensitization and reproductive health education for both the young girls and the women, so that you can prevent this issue.
All right.
Okay, for me, I would say that when health professionals or NGOs are clamoring for availability of abortion, it's not an abortion agenda. It is, we're trying to just save women's lives. We're trying to make women's life longer and more productive. Okay. And then it's a public health crisis, yes. And then it needs an urgent attention. Okay. Like we mentioned earlier, access to contraceptives, education, not just for the females, for also the males. And also when it comes to contraception, it is not just a conversation for females. Men should use contraceptives also. It's funny when you go to buy a condom, or people think that condoms as the barrier method contraceptive is for only single people. For married people, they can also use condoms. So we should start talking more about contraceptives, breaking it down and demystify, and just talk about the myths surrounding contraceptives. People think that contraceptives are unhealthy, or it's an agenda to reduce population or to reduce fertility. But it's not. The risks the benefits far outweighs the risks. Yes.
All right. Dr. Georgina.
So what I'd like to say is that whatever we think and whatever is on paper is far from reality. Like you've said, 92% of women live in the 43 countries that have restrictive laws, right? So yes, they have put on laws to stop abortion. But like I've said, out of 10 pregnancies, 3 end up in abortion. And imagine in these countries that have restrictive laws, they end up doing unsafe abortions, which later to translate to complications like hemorrhage, sepsis, and even death. So in our bid to stop abortion, in our bid to try and protect human life, I'd say we should put in laws that should also consider the woman as a person. The Maputo Protocol was put in place, but not many countries have implemented it as we've thought. So it's good that we should sit on again and try and bring in the woman into perspective. Yes.
I would also say, laws or policies that make it difficult for a woman to access self-abortion, deny the woman the right to choose when and how to have her children. So when the woman carries this pregnancy to term, she has been denied a choice over her body.
Okay, so I'd like to wrap up by saying that restrictive abortion laws do not stop the incidences, or it doesn't stop women from trying to get abortions, right? It only increases unsafe abortion, it increases complications of abortion, and it just increases death, maternal mortality.
Yeah.
Yes, exactly.
That is a very important point on which we shall end this particular episode of the Med Squad podcast. Now, any information you hear that is helpful to you, beneficial or educational to you, you share it. And also you can inbox us if there's something you'd like us to address. You can inbox us, just talk on the side. There may be something that you want that is more personal, that is spoken to you. And of course, you can follow us on all our socials at the Med Squad Pod. We'll see you next time.